If I asked you where your shoulder joint is, it would be a no-brainer. You'd point to it in a split second. However, if I asked you a follow-up question and asked you to tell me how your shoulder works, you'd probably have difficulty answering this question. In this short video, I will be providing you with a brief overview of how the shoulder works and why it is so vulnerable to injury. My hope is that you will understand the complexity of this joint and that you will be better prepared to care for your shoulder and prevent pain and injury. I want to begin by providing an overview of what makes up the shoulder joint. The shoulder is actually made up of many parts. First, in looking at just the bones, we see that the shoulder is made up of 3 bones. First, we have the shoulder blade, or the scapula in the back, the humerus, or the upper arm, as well as the collarbone right here. Looking at this model, we can see the next layer of the shoulder joint. In addition to the bones, this complex joint is made up of several ligaments and muscles that make up the rotator cuff. And now looking at a real-life shoulder, we see that on top of the bones and the initial layer of muscles, that there's a whole entire other layer of muscles, skin, and fascia that attaches to the shoulder. A few examples of the muscles attached to the shoulder are the chest muscles, or the pectoralis, as well as the upper shoulder and neck muscles. And then looking from behind, we see the mid-back muscles that attach into the shoulder blade. Bottom line, the shoulder can be influenced by problems in any one of the many parts of the shoulder. So if there's tightness in a specific muscle or weakness in another muscle, or if a ligament is tight or shortened, any of these structures can change the alignment or position of the shoulder. This can then affect how the shoulder joint moves and put the shoulder at risk for injury. An analogy that I like to use is looking at the car. When the alignment of your car is off, what happens to the tires? The tires wear out unevenly on one side and may eventually blow out. So in a similar manner, if the shoulder is out of alignment, the shoulder will not move as it should, and certain parts of the shoulder will have added stresses placed on it, which will lead to injury. Let's look at this on a real shoulder. One example is if the chest muscles or pectoralis are short and tight, it'll draw the shoulder forward and rotate it in. And so now the shoulder is out of alignment or in an abnormal position. And so when the arm is raised, the shoulder is out of position and impingement or pinching could happen inside the shoulder. Another example, looking from the side view, is if the stabilizers of the back of the shoulder are weak, or if there's stiffness in the mid-back, the shoulders can then become rounded and come forward a bit. So now the shoulder is in an abnormal position or out of alignment, and so now when the shoulder moves or raises, again, is not in the right position, and you can have abnormal stresses placed in the shoulder, which could then lead to injury. My hope is now that you see how complex the shoulder joint is, that you will take extra measures to maintain a healthy shoulder through maintaining proper posture, mobility, and strength.